So hello everyone. So welcome mga diday. So ayan. So yung iba dito pumasok lang kasi they wanted to have a plus. So let's go over and finish this. Ayan. So remember, medyo I am quite hesitant to talk about this one because parang ang weird, no? So that's why I decided to just not cover sexual assault, but acts of violence. So remember that in the PNLE or even in the NCLEX RN examination, you'll get to encounter, okay, acts of violence. So it would fall under safety and infection and prevention control, pwede rin po for health promotion. And then we also have your psychosocial integrity. But for the PNLE, of course, it will be under your psychiatric nursing, no? Specifically, for example, when we talk about your rape or even other, like for example, rape victims would usually, they might experience PTSD. So pwede rin po siyang as a form of crisis. Okay, so welcome aboard future RNs and future US RNs. So may I ask, do we have any foreigners around here joining us today or kayo po ay mga foreign lang? Let me just see. Ano pangalan si Dorothy? Dorothy, are you Filipino or you are pretending to be a Filipino? Okay? So
Ganyan.
tingnan natin. Ano daw? I am hearing voices. Oh, from Kenya. Okay, so we have friends joining us from South Africa. Okay, so allow me to introduce myself. I am Mentor McLean. So I've been a nurse 2021 and a USRN since 2023. Okay, so let's move on and I'll be writing on the screen. So we have someone from Ghana. Okay, so you say Ghana if you wanted to eat in the Philippines because you have Ghana, right? Ghana means appetite, correct? So my Filipino students here, Ghana means appetite, no? Okay. Then when you say Kenya, it's not yours. It's for them, right? Kenya. Okay. So those are, Filipino slangs, okay? So just kidding. Okay, you might like for example, when you try to search Kenya, for those who are living in Kenya, you can search Kenya and then you can also search Ghana. Yeah. So Ghana means appetite. Kenya means it's his or it's her. Yeah. Okay? Okay. So let's talk about sexual assault. So take note, in the NCLEX, you might find questions about sexual assault. So sexual assault could fall under your, for a while, let me just write it here on the screen. Okay. So sexual assault could be, remember this keyword. So when we talk about your sexual assault, it is any non, hindi na nagsusulat siya, te. For a while. So I'm just going to type it. Tignan ko nga dito. Okay. Kanina it's working. Oh, okay. So let's go over. Oh, I'm not going to write. Okay. So let me just double check it. Ayan. Ano nangyari sa aking pen? So for a while, I'm having a trouble in relation to my pen. I just charged it a while ago. I don't know what's wrong. Okay, for a while. So pardon me on that interruption. So let's go back. So when we talk about your sexual assault, so always remember that sexual assault would encompass, remember, any non-consensual non-consensual sexual act. Okay. So remember, when you say sexual assault, I repeat, these are non-consensual sexual act that may include wedding rape. Okay. You can also include attempted rape. We also have your unwanted touching. And you can also add sexual coercion. Okay, but of course, we will only focus on rape because this is a staple or a common question or a common concept when you get to encounter NCLEX and PNLE at the same time. So remember, whenever you see sexual assault question like rape, so the first thing that you need to do or your first action would always be ensure safety. So first action would always include, what did I say? Safety. Then aside from you ensure that the patient is safe, then that's the time you add your emotional support. You provide emotional support. Okay? So for example, you could say, you are here. You are safe here. Stay with the patient. Don't forget that. So remember, you can always say yung keywords natin like, you are safe here. Then you have to stay with the patient. And remember, you can also assess for life-threatening injuries. Lalo kapag if that's, for example, a sexual coercion or attempted rape, you also need to assess for life-threatening injuries. So it will also fall under your EBCs. Okay? So let's go over. So take note that rape is an act of violence. That's correct. So what do we need to do in relation to rape? So remember, a very common concept in the NCLEX and NLE in relation to rape is what we call your trauma-informed care. Trauma-informed care. Okay, so what do we mean when we say trauma-informed care? So basically, these are steps on how you're going to manage someone who had experienced rape. Remember, rape is an act of violence toward other people. Okay, so when you say trauma-informed care, the first thing that you need to do is that use a non-judgmental approach. Non-judgmental approach, and at the same time, dapat you also need to be calm. Okay? Then take note, allow patient, okay, to verbalize feeling. Okay? To verbalize feelings. And at the same time, first and foremost, aside from that, I forgot, provide privacy. Provide privacy and at the same time, control. So who will be the one to control? The one who will control will always be the patient. Okay? And don't forget that you need to ask permission, okay, before procedures. So if there's no procedure but you would say consent, then that's the same as with your procedure. So remember, sometimes no, there are certain cases that there are non-therapeutic nurses no that definitely they would blame the patient. Like for example, why didn't you call right there and then? O, diba? Then take note. What do you call this one? Do not rush the patient. Okay? So remember, that is a traumatic event. So you have to make sure that they're still in control and provide privacy. And of course, you need to allow them to verbalize their feelings. And most importantly, you have to ask permission before any procedure. Okay. So let's try answering sample questions. Okay. So which of the following statement about rape is true? What do you think? So go over with the options and give me an answer. So which of the following statements about rape is true? So people who walk in groups are least likely to be raped. We can consider that one. Rape victims usually becomes prostitute. Do they become prostitutes right now, right there? No, actually, because remember, when you are prostitutes or sometimes you call it your sex workers. So you might keep on remembering the event, no? So eventually it could lead to possible PTSD. So wrong. So wearing sexy dresses increase the likelihood of rape. So remember, There's no connection in relation to wearing sexy dresses because remember that rape is always planned. Okay? It is planned. Okay. So wearing sexy dresses increases the likelihood of rape. No. Even if you're going to wear the most ugly dress, or even if you might worn rags and whatsoever, if you are to be raped, you will be raped. Okay? So rape occurs as an accident? No. Remember that rape is planned. It is planned. Okay? So you have to be very careful with strangers, specifically like don't give your address, don't give your contact information, because definitely they're going to plan it out ahead of time. Okay? So the best answer here is number one. People who walk in groups are least likely to be raped. That's correct. But please make sure that whenever you walk in groups, make sure that the groups you are joining with are not group of rapists. Because if those are group of rapists, if eventually it will increase the likelihood of being raped. Okay? So people who walk in groups are less likely to be raped. And of course, if for example, if you are working at night and if you are a lady, please don't, you know, you have to be very careful. You have to make sure that anytime soon you will be attacked. So you have to be ready. Okay? So make sure to have your pepper spray, you have your taser. Okay. Don't forget that. Okay. So let's go over. Okay. So for which of the following statements should the nurse provide a client for the prevention of rape? So remember, prevention is better than cure. That's correct. And take note that could be lead to individual crisis in the long run. So let's go over and try to answer this one. Shout fire if someone suspicious attempts to get close to you. Do you think that's appropriate? Shouting fire? Or in Filipino, sunog, sunog, sunog. Do you think that would help? Okay. The answer is yes. You can shout fire because this can get attention of bypassers. Okay, or neighboring people around you because they don't want to get caught into that fire because fire is deadly, of course. So if helpless, request for the use of condom, that's correct. Ma'am, why? Okay, why do we need to request for a condom? Remember, we need to protect yourself from sexually transmitted infection. So it's very important that if you can no longer resist, then request for the use of condom. So you could say, oh, up, no condom, no rape, gaga, hindi pwede yon. Okay? So just kidding. So remember, if you can no longer, if you are helpless, then instead of you getting killed by the rapist, then just allow yourself, okay, but make sure to request for a condom, okay, to protect you from sexually transmitted infection. So ma'am, does it mean that if I offer condom, I am agreeing with the action? No, you are just protecting yourself from from acquiring your sexually transmitted infection. Okay? Don't forget that, my dear colleagues. Okay, especially ladies, no, there's increased likelihood that you are you are to be raped. No, unlike for men, but men can also be raped. Okay? Yan. So walk in groups, that's correct. So be mindful of drinks being served while dating, that's correct. So there are medications that could be mixed into your food or into your drink. So we can give them Versed, Midazolam. So those are common rape drugs. Then rape is not about one choice of theirs. That's correct. So if you are planned to be raped, regardless of what is your outfit, you will be raped. So rape is committed only by stranger. Wrong. So usually rape is done or committed known to the victim. Like for example, their father, their grandfather, their uncles, their ano pa ba? Yeah. No? So this could usually it's the victims are known to the victims are known to the perpetrators. Okay? So let's go over. Ayan. So take note, what this is your priority flow in relation to if someone is brought to the emergency room and you suspect that the patient has been raped. So first, we need ABC, so treat injuries. So if there are life-threatening injuries, then treat it first. Next, ensure safety. That's correct. Then emotional support. Okay, consent for examination, that's or your ask permission. Need to collect your evidence. Okay, then medications like STI, pregnancy, and HIV medications. And then of course we have referrals for counseling and for legal. Okay, remember, what are other key points in relation to this one? So remember that consent is necessary to obtain first before any procedure. And take note, you need to maintain the chain of custody. So pag sinabing when you say chain of custody, there are parameters that you need to follow, specifically if a patient was raped. Next, what are high yield concept in relation to your uh, what are important instructions that you need to reiterate or educate your patients know if they are raped? So first, tell the patient if possible before the examination, do not bathe, do not change clothing, do not eat, drink, or brush their teeth. Okay, unless, okay, like for example, if for any reason they already have taken a bath, they have already changed the clothes, then still proceed with care and support. Okay? But as much as possible, ask them if they have taken a bath, if they have changed their clothes, and ask them if they had eaten, drink, or brushed their teeth. Okay? Next, in relation to handling the clothing. So when you handle the clothing, remember, it's important for you to place the clothing in a paper bag, not plastic, because if for any reason you place them on a plastic, it will eventually, okay, what happens if you place it on a plastic? So it will accumulate moisture. So this moisture will destroy the evidence. So as much as possible, place them on a paper bag to prevent moisture. So if you prevent moisture, there would be preserved evidence. Next, so when we talk about your medications here, so when we talk about your medications, remember, we have to give them your STI prophylaxis. So usually we have to give them antibiotics like ceftriaxone. That's the most common antibiotic if you suspect that there would be STI exposure. Next, you can also give your emergency contraceptions to prevent emergency, or sometimes they would ask to drink white pill. So these white pills are emergency contraception. Then we also have your PEP, your post-exposure prophylaxis, no, for HIV prevention. So usually it is given 3 days. So within 3 days after your um incident. Okay? So take note that if for any reason, remember, if the rape victim is an adult, take note, reporting is a choice. So reporting is patient's choice. So it's up to you, no, if you want to report. But if it is a child or like your mga vulnerable groups, so remember, reporting is mandatory. Okay. Remember that reporting is mandatory. Okay. Take note in relation to adults, never force the patient to report. If they don't want it, then wag. Okay. So let's go over and try to answer this one. Yeah. So management of rape victims should include which of the following intervention? So do we stay with the patient? Remember, counseling, legal support. That's correct. So ask the patient whether the client took a bath. That's correct. Place clothing in a paper bag. Correct. So collect fingernail scraping. That's correct. But before any collection, you need to get the informed consent or ask permission. Then photograph bruises and ecchymosis. That's correct. And refer for psychological counseling. So remember, this is the last step. But if for any reason there are ABCs here, like life-threatening, as for life-threatening conditions, then you can also add that up. Okay? Medications that you can give, HIV prophylaxis, antibiotics, and pregnancy, emergency contraceptions or contraceptives. Okay. So let's go over. So a sexual assault survivor arrives at the ER. So what is the nurse's first action? Or what will be your answer, my dear colleagues? A, B, C, or D? What will be your best answer? Collect forensic evidence. Oh, that's also correct. Encourage reporting to the police. So it depends if that's an adult or a child. So assess airway injury. That's correct as well. Ask patient to describe the assault. Actually, all options are correct, but take note the keyword here is first action. So what will be your priority? It's still your ABC. Tama. So assess airway and injury. And then follow through with the sequence we have provided a while ago. Correct. So let's go over and talk about your domestic violence. So I know I'm a product of a domestic violent family. So a little bit of story, but it's been a long time. So my mom is a battered wife. Yeah. So my dad used to hit her every morning or every evening. So we were child back then. Parang I do remember it that I also go to school with, bruises on my face. And then every time they ask me, what happened to your face, I always lie because I don't want them to see the family. It's like that. So I would always lie and tell them that, I got it into an accident and so on. But definitely, no, I think teachers would not believe that that's the case. Okay? Ayan. So, but over time, no, mom was able to get out of that abusive relationship. Yun ang mahirap. That's difficult with domestic violence because it's a cyclical event. Okay? So let me explain. No? So when we say your domestic violence is, take note, this is the keyword when you say domestic violence. Okay. So domestic violence is a pattern. Remember, pattern of tawag nito, coercive behavior. Coercive behavior. Okay? Use to gain control. Okay? So this could include physical abuse. Okay, what else? Physical abuse. You can also add emotional and psychological abuse. Psychological abuse. You can also insert here sexual abuse. And then financial then. Financial control. Meaning you have financial control. Meaning, like for example, in the family, you have difficulty controlling your finances. You cannot budget it properly. That could also be a form of domestic violence. Okay? So I repeat, domestic violence is a cyclical event. So remember, this is a pattern of coercive behavior used to gain control. So it could be physical abuse, emotional, psychological abuse, sexual abuse, and even financial control. Okay. So I repeat, so this is the cycle, no? Yan. So these are the common. So we have your tension building. So take note in your tension building. Okay. In here, like for example, who is the common abuser? Usually it's the spouse or the husband. Okay. For example, the husband did not get the promotion at work. So what happens? So of course, he cannot direct his anger towards his boss. So eventually, there would be tension building. Okay, next. We have your incident here because the husband can no longer control, okay, because he keeps on failing and everything and so on. What happens? There would be projection of that built up emotion. So eventually, who will be the um object of that projection of that anger? So it will be the wife. Okay. So what happens? There would be verbal, emotional, and physical abuse. And then take note, reconciliation happens. So in reconciliation, the abuser apologizes, gives excuses, blames the victim, denies the abuse occurred. Yes. And then over time, this is what we call your calm, or sometimes you call your honeymoon phase. That's why it's a cyclical event. It's very difficult to get out of this abusive relationship. Okay? Because of the different stages. For example, your husband or your partner would say, I am a renewed man, so please forgive me. I'll change for good. Oh, your empty promises. Yan. That's why it's very difficult to get out of this abusive relationship. So what will be our goal as nurses? So remember, we don't force our abused wife, if they are the one abused, no, to get out of that abusive relationship right away. Remember, it's a process, no? So I remember my mom, parang I think parang pina-blotter pa nga yata dati yung dad ko before. I think I was grade 6 back then, grade 5 sister ko, and we have a grade kindergarten yung brother ko. Yan. So, yeah. No, you know what? The question asked by the I can remember it. Why do you don't want to get out of that abusive relationship? Because mom cannot support us alone. Okay, so of course she chose to stay. No, she chose to stay because she doesn't want her children to suffer because of monetary or finances. Okay, so lucky you. But if for those people who are experiencing the same thing, I am with you. I am, but definitely, if it's really difficult to get to get out of that abusive relationship. But eventually, over time, they'll get to realize that they have to get out of that cycle. It's hard, but definitely it will come. No? Yan. So take note, what are other clinical signs that you have a tag ito? Abusive family or abusive partner and so on. So like for example, if you get to see, injuries, injuries at different stages of healing. Mm. Injuries at different stages of healing. So sometimes, no, they are also like, for example, frequent ER visit. Mm. Frequent ER visit. And then they keep on saying that experience accident, but frequently. Next, sometimes if they would also have, if there is frequent ER visit, we also have delay in seeking care. Delay in seeking care. Because they, as much as possible, they wanted to hide. No? Yeah. And if they have fearful or submissive behavior, specifically wives, they would just agree with what their husband is saying. Yeah. And then what else? This one. Very obvious. Partner is answering questions for the patient. Yeah. Those are other testable clinical symptoms of a patient, no, in a domestic abuse or domestic violence. Okay? So injuries at different stages of healing, frequent ER visit, like they assume that it's an accident, then delay in seeking care, then wives have fearful and submissive behavior towards their husband, and partner is answering questions for the patient because they wanted to hide. They wanted to act as perfect. Okay? So let's try answering this one. So very basic lang naman ito. Okay. So battered wife syndrome, victims go through several stages of the condition. So that's domestic violence still. So arrange the following events in order of occurrence. So of course, it's your tension building phase. It's your incident. Okay, there would be verbal, sexual, abuse. Then we have your reconciliation. Okay, so guilt, diba? And then of course your honeymoon phase or your calm phase. Okay, so just remember the events in the particularly on the stages. So definitely they might you might encounter that one on the PNLE. For the NCLEX, you might encounter it such like this, trying to arrange it. Okay. So let's go over. This is your priority flow for domestic violence. So assess safety. So remember, safety first is always the correct answer, regardless of what condition is that. Next, we have to ensure privacy, then provide emotional support, document findings, then offer resources like hotlines and shelters, and then respect patient autonomy. Okay. So you can also use your therapeutic communication in this situation. Okay. What else? You avoid statements like, why don't you leave? You should report this to the police. Wrong. Those are traps in relation to choosing your therapeutic responses. I repeat, please avoid using words like, why don't you leave? You should report this. Those are common, no? I've been seeing questions quite often for the PNLE, and I see those words. So those are automatically wrong. So what now then are your therapeutic phrases? So you could use like, help is always available, you do not deserve this, I am concerned about your safety. You can use those. Okay? Next. Remember, in relation to reporting, I did mention a while ago that same with your sexual abuse, reporting for adult is a choice. But for elderly, for children, it is mandatory. Okay? But if you are unsure, so always think autonomy versus protection. Yeah. So for example, if you're unsure if you're going to report it, always think autonomy versus protection. Okay? Yan. So, ma'am, what do we need to do now then? Like, for example, so in relation to planning, like, for example, remember, that's a pattern, no? Right? So, it could occur quite often. So, for example, it did not happen this month. Probably after 2 months from now, it will occur. So, what do you need to do? We need to do safety planning. And like, for example, you can ask the victim to pack emergency bags like ID, money, meds. Okay. Then, of course, they always have to identify what is the safest place for them. Like, for example, in event that they're going to be for example, that comes the event again to detention building, and then your incidents. Sasaktan na siya. So what happens? Identify safe place. Like, for example, what will be your available or what would be the nearest shelter available for the patient in the event na they're going to there's this problem towards towards her wife, towards her husband. Okay? Then you can also encourage them to memorize emergency numbers to call in the event that there would be abuse. Okay? And then of course you can also establish trusted persons that they could call. For example, a friend, a neighbor, they can do that. Okay? So in relation to your documentation as well for legality, so of course you have to use objective, factual statements like for example, patient states, my partner is hitting me. You can do that. So avoid assumptions, ha? Okay. So let's go over here. So let's try answering this one. Ay, may sagot na agad. So a nurse in the emergency department suspect that the client is experiencing domestic violence. So which of the following nursing actions are appropriate? So like all that apply. Interview the client in the presence of the partner to avoid suspicion. Take note, this is very unsafe and this may prevent disclosure. So provide a private and safe environment for assessment. That's correct. So providing a private and safe environment would foster honest communication. So the patient will truly open up with you. Okay? As open-ended, non-judgmental question about injuries, that's correct. So asking open-ended and non-judgmental questions would promote trust. But remember, one of our goal is for the victim to develop or to develop um communications to persons to whom they could trust, right? Next, encourage the client to leave the abusive relationship immediately. Wrong, no? So if you encourage the client to leave the abusive relationship immediately, it would eventually, no, you're trying to remove their autonomy. Okay, and it will also increase danger, specifically if, no, the husband. Okay? So document the client statement using direct quotes, that's correct. Remember, objective. Yeah. Okay, factual. Then offer information offer information about community resources and shelter. That's correct. So, di ba, it is under your safety planning. So, without forcing your decisions. So, remember, it's still autonomy, no? At the end of the day, the patient will be the one to decide if they wanted to get out of that abusive relationship. So, all we need to do is to make sure that shelter, community resources are available. Okay? Yeah. So, before we end our lesson, so let's try to compare this one. So let's try to answer. So a nurse is caring for a client experiencing sexual assault and domestic violence. For each nursing action, indicate whether it is appropriate or not appropriate for its situation. So let's go try to answer. So ensure private environment away from accompanying individual. Ensure a private environment. Yes, both. Yes, for both. So encourage the client to immediately leave the abusive partner. So abusive partner, ang sagot natin dito is no for both. Unrelated naman po ang ating rape. So obtain informed consent before any examination or intervention. That's appropriate. So instruct the client to avoid bathing or changing clothes prior to care. That's more of your sexual assault, not for domestic violence, unless it is stated that That could also be sexual abuse. Next, collect forensic evidence using rape kit. Rape kit is only for sexual assault, not necessarily for domestic violence. So provide discrete information about shelters and community resources. That's more of your domestic violence over your rape. So inform the client that reporting to authorities is mandatory. Mandatory ba for adult? No, diba? It is only mandatory for children, but for adult, it's still their choice. And do not rush the patient if it's for rape. Then document statement using direct quotes and objective description. Yes, for both. Okay? So your key takeaway in relation to your sexual assault and your domestic violence. So remember, these are both acts of violence. So remember, key things you need to know: ensure private environment and make sure to assess your life-threatening situations or conditions if you are facing with the patient. And remember, informed consent is necessary. And of course, autonomy and providing what? Options. Okay, so syempre both would require psychological referral because both would have something to do with emotional support. Okay, so I think, yeah, so that's it, everyone. Ayan, so that's our very short discussion in relation to our acts of violence, specifically rape and sexual assault. Okay. So, ayan lang. So, very short lang po tayo today. Hindi ko rin alam bakit yun ang binigay sa akin, sexual assault. Parang feeling ko, sana wag naman. Okay? So, thank you everyone. So, blessed day and see you next week see you again next time for your another study group session. So, thank you everyone. Good night and happy Monday.